All right, so we're going to talk about the diaphragm and the pelvic floor and how those structures kind of mirror each other in terms of mechanics. So when we inhale through our nose, our diaphragm contracts down, spreads our ribs in all directions, comes down into all of our organs, and then helps to lengthen the pelvic floor. So as we inhale, there's a descent of the diaphragm and the pelvic floor. And as we exhale, the diaphragm recoils back up and pulls the pelvic floor along with it. So we inhale, we exhale, we inhale, we exhale. So I want you to try to sit with that and see if you can sense any of that passive range of motion at your perineum, sitting on a chair. See if you can, on an inhale, feel maybe just a little bit of subtle pressure down into the chair on an inhale, and maybe a little bit of a lift as you exhale. It's not, the pelvic floor is not doing anything, it's just along for the ride. Diaphragm is doing the work. So you can just try that passive normal breath first and just kind of see if you can feel that range of motion. After you sense that, and it's very subtle, it's not like earth-shattering range of motion at all, it's very, very subtle. After you do that, you can start with a little bit of a forced expiration. So you inhale, those ribs spread in all directions, kind of like an umbrella. And when you exhale through your mouth, you can think about blowing through a straw. So like purse your lips and blow through the straw. As you do this, you may feel your abdominals kick on a little bit, and you may feel a little bit more of a contraction at your pelvic floor. So inhale, get that good umbrella expansion. Exhale, blow out the straw. See if you can feel the engagement in your abdominals and maybe a little bit of a contraction of the pelvic floor. You should feel it kind of pick up off of the chair a little bit. So see if you can do that for a little bit. And as you go along, you can start to increase the force of the exhale, get a little bit more of that balanced contraction of the abdominals and a little bit more of the pelvic floor contraction, or a Kegel. And just kind of see if you can sense that range of motion. You exhale, the abdominals come on, the contraction happens at the pelvic floor, and you're lifting up off of the chair. So that's the contraction piece of it. See if you can then focus on a full release on the subsequent inhale. A lot of times for many people, that's the most important part. Great, you can contract, but can you get a full relax after the contraction? So see if you can kind of sense that. We're just kind of trying to establish a stronger connection between the brain and this part of your body, and just kind of see what you can feel. Okay, and then there's a lot that can be done to kind of work off of that foundation, to come afterwards.